Let's start. So good evening to all those who have joined online as well. I am Dr. Omkar. I welcome you all back to the session of Sparks by AFMG, and this is the first chanting session for surgery. So I hope without any delay we can start the session. If you haven't joined the Telegram group, feel free to join the Telegram group. ठीक है ना? I hope it is fine. So let's start. So this is the quote I just came across today, and I hope like you all will help me as well. So here they have written that go where your energy is reciprocated, celebrated and appreciated. So I feel the same in class, like the same amount of energy I expect from you guys as well. Though we are not feeling well, still I'm here. So I just expect a bit of silence in class, and throughout the session we'll keep on revising things. So be loud and clear, okay? So starting with our session for surgery, starting with general surgery, I hope all of you are clear that we were going to discuss general surgery in today's session, right? So first of all, talking about an important point, and that is hemorrhage. We have discussed the same point in ENT also in one of the questions, because now this question had come once or twice in last 3 sessions, so it has become important. So let's discuss about hemorrhage. Hemorrhage means bleeding. That can be of 3 types. Either it can be a primary hemorrhage, reactionary hemorrhage, or a secondary hemorrhage. Primary hemorrhage means any bleeding that occurs during surgery. Yeah, during operation or surgery, any bleeding that occurs is known as primary hemorrhage. Then reactionary hemorrhage is any bleeding that occurs within 24 hours of surgery. Any bleeding that occurs within 24 hours of surgery is known as reactionary hemorrhage. Whereas third type is secondary hemorrhage. Any bleeding that occurs after 5 to 7 days of surgery is known as secondary hemorrhage. Any bleeding that occurs after 5 to 7 days, after 5 to 7 days, within 24 hours of surgery, within 24 hours of surgery, and during surgery, primary hemorrhage. Now can anybody tell me which is the most common cause of reactionary hemorrhage? Very good. The most common cause, and this was the question, the most common cause of reactionary hemorrhage is slipping of ligature. So if you have applied a suture and that gets slipped, that can be the most common cause of reactionary hemorrhage. Apart from this, there can be dislodgement of a clot also, that can also cause reactionary bleeding. But the most common cause of reactionary hemorrhage is slipping of ligature. So please tell me the treatment for this then. So the treatment would be re-exploration and religate. What is the treatment? So we'll again open the surgical site and again tie a suture. That's it. So what is the treatment of choice for reactionary hemorrhage? Re-exploration and religation. Then secondary hemorrhage, which was the most common cause we discussed? Infection. So what happens usually? Infection at the surgical site can lead to which type of hemorrhage? Secondary hemorrhage. And what is the treatment of choice therefore? IV antibiotics. So jaldi say treatment of choice for reactionary and treatment of choice for secondary IV antibiotics, because the most common cause of secondary hemorrhage is infection. I hope this is fine. Now tell me which is the best method to control bleeding? Very good. Applying direct pressure. Applying direct pressure with the palm of your hand, not the fingers. Okay, important. So apart from this, if the bleeding does not stop on applying direct pressure, we can elevate the part, or we can apply artery forceps, we can apply clips, we can apply sutures, we can use materials like gel foam, spongostan, multiple things. Okay, but what is the best method to control bleed? Direct pressure, important. Okay, so this was about hemorrhage that you need to remember. Then if we talk about blood donation, guys, can anybody tell me blood donation की various components क्या-क्या होता है? The most important component that is transfused in cases of anemia. Anybody? Plasma anemia में क्यों देंगे? Very good. It is packed RBC, PRBC. What is transfused in cases of anemia? Packed RBCs. Okay, packed red blood cells. Then in cases of thrombocytopenia, will transfuse platelet concentrate. In cases of thrombocytopenia, platelet concentrate. Then anybody, warfare and toxicity, we have discussed this in pharma. Very good. The treatment of choice for warfarin toxicity was four-factor complex. Treatment of choice for warfarin toxicity. Treatment of choice for warfarin toxicity. Four-factor complex. That is clotting factor 2, 7, 9, and 10. Right? I hope you remember this. Then next, in cases of any of the other coagulopathies. Very good. It is fresh frozen plasma. Important. FFP, because FFP is the richest source of clotting factors. So which is the richest source of clotting factors? Richest source of clotting factors? Richest source of clotting factors? FFP. So these are the various components that would be transfused in multiple conditions. Now tell me, 1 unit of blood in India contains how much ml of blood? 350 ml. Around 350 ml. 1 unit of blood in India? 1 unit of blood in India? Whereas in the US it is 450 ml. Okay. Then if we talk about the size of needle used for blood transfusion, what is the size of needle? The most commonly used is 16 gauge. Most commonly used is 14 can also be used for rapid, but 16 gauge is the normally preferred one. So the size of needle for BT is? Size of needle for BT is? Size of needle for BT is? 16 gauge. Okay, important. Then this blood which is withdrawn from the donor, it is usually collected in a pre-sterile bag, and this pre-sterile bag is usually it usually contains some anticoagulants. Important question on anticoagulants. They can be of two types. It can be either CPD, that is citrate, phosphate, dextrose. Citrate, phosphate, dextrose. And the half-life of CPD would be 21 days. Half-life of CPD? Half-life of CPD? Half-life of CPD? Or we can use CPDA. That means citrate, phosphate, dextrose, acetate. Citrate, phosphate, dextrose, acetate. And the half-life of CPDA is 28 to 35 days. Half-life of CPDA? Half-life of CPDA? So this was a question in NEET PG. That's the reason why I have included. So which anticoagulants are present in the blood collecting bag? CPD or CPDA. Half-life of CPDA is 21 days. And half-life of CPDA is? Very good. Now tell me an important question. The temperature at which blood storage is done? 4 degrees Celsius. Temperature of blood storage is? Temperature of blood storage is? Temperature of blood storage is? Very important question. Okay, it has been repeated. Please remember, usually it can be plus minus 2. Therefore, the range becomes 2 to 6 degrees Celsius. But on an average, the temperature of blood storage would be 4 degrees Celsius. Moving further. Now, when we transfuse a blood, normal lifespan of RBCs will be impaired. Normal lifespan, shelf life kitni hoti hai RBCs ki? 120 days. Very good. Okay. But in cases of transfused blood, the shelf life or the shelf life of the lifespan of RBCs decreases, and it would be 50 to 60 days. How much? So RBC lifespan in transfused blood? RBC lifespan in transfused blood? RBC lifespan in transfused blood? And this leads to another question of ours, that RBCs are repetitively damaged in cases of transfused blood. Therefore, they release potassium inside the blood, and therefore one of the important complications of blood transfusion would be hyperkalemia. And this was the question. Okay, so important complication of transfusion of blood would be hyperkalemia. Important. Then the lifespan of RBCs in a stored blood would be? Stored blood. Very good. It is 24 to 72 hours. Stored blood में? Transfused blood में? And normal lifespan? Shabash. Then sorry. Then the blood is usually kept at such a low temperature of 4 degrees Celsius. Therefore, before transfusing it, you need to warm the blood. This is known as warming. Otherwise, the patient will likely suffer from, very good, hypothermia. So, warming of blood is usually done with the help of a warm blanket. Okay, the blood bag is wrapped in a warm blanket. For how much time? This is a question. For how much time minimum or maximum? So minimum it should be wrapped for 30 minutes. So please remember, warming should be done for? Warming should be done for? Blood warming should be done for? So before transfusion, blood should be warm for 30 minutes. But it should not exceed 2 hours. Okay, it should not exceed 2 hours. Otherwise, the patient would be likely for a risk of bacterial infection. Okay, important. Moving further. Now talking about the BT set. Okay, this blood transfusion set is not like a normal IV set. Okay, it is provided by the blood bank itself. This BT set usually has a filter in it, and the size of the filter can be asked. And the size of filter would be 40 micron. Size of filter of BT set? Size of filter of BT set? Size of filter of BT set? Needle of size of needle of BT? 16 gauge. 1 unit of blood in India? 350 ml. Very good. I hope this is clear with everybody. Moving further now. Talking about complications of blood transfusion. Can anybody tell me most common complication of blood transfusion would be? Very good. It is known as simple febrile reaction or pyrexial reactions, we can say. That is fever, nothing else. Okay. Most common complication of blood transfusion? Most common complication of sorry. Most common complication of blood transfusion? Simple febrile reaction. They are commonly due to the presence of pyrogens or organisms in the donor's apparatus. Okay, that is the cause. So most common complication of BT is? Then there can be another complication that is known as ABO incompatibility. That means patient tha A positive, tumne chadhaya B positive. Okay, this is ABO incompatibility, also known as mismatched blood transfusion. Okay, and the most common cause of mismatched blood transfusion is clerical error. Tum galti karte ho chadhane wale. ठीक है, that is the most common cause. That is all of us means. Okay, so healthcare workers usually do this mistake, and that is known as a clerical error. This was a question in NEET PG. So most common cause of ABO incompatibility is? Most common cause of ABO incompatibility is? Most common cause of mismatched blood transfusion is? Most common cause of mismatched blood transfusion is? Clerical error. Then if we talk about the sign and symptom, okay, if there is a mismatched blood transfusion, what would be the most common sign and what would be the most common symptom? If I talk about sign, तुम्हें कैसे पता लगेगा? Fever is not seen due to ABO incompatibility, usually in early stages. Yeah, very good. So it is oliguria. Okay, a component of shock again. Okay, so please remember, most common sign would be? Most common sign of mismatched BTA? Most common sign of mismatched BTA? Oliguria means urine output less than 400 ml per day. Normal urine output was 1.5 to 2 liters per day. Oliguria means urine output less than? And anuria means urine output less than? 100 ml per day. Less than 100 ml per day. Okay, most common sign of mismatched blood transfusion? Most common sign of mismatched blood transfusion? Oliguria. But now what the patient will complain to you? Most common symptom of mismatched blood transfusion would be? Pain and heat sensation along the vein. Okay, so pain and heat sensation. So when in which vein you are transfusing the blood, the patient will complain, यहाँ पे दर्द हो रहा है, यहाँ पे सूजन हो रही है, यहाँ पे गर्मी हो रही है. Okay, so that is what is the most common symptom. So important, most common symptom of mismatched BT is? Most common symptom of mismatched BT? Pain and heat sensation along the vein. Most common sign? Most common sign? Most common sign? Most common symptom? Most common complication of BT? Very good. Okay, yes, phlebitis would develop. That would be the reason for pain and heat sensation along the vein. Very good. Okay, this was about BT, at least you need to know. Apart from these two important complications, if we do a massive BT, massive blood transfusion is done, there will be excess of volume that can lead to congestive heart failure. Then destruction of RBCs was leading to Kalemia, hyperkalemia. There can be metabolic alkalosis also. Important. Metabolic alkalosis is seen and not acidosis in massive blood transfusion. ठीक है? At least ये याद रख लो. इसके अलावा बहुत सारे होते हैं, but these are probable questions. Moving further, talking about classification of wounds now. I have intentionally included the images over here because these can be asked from forensic also, or it can also be asked from medicine. It can also be asked from surgery. But because nowadays they have started asking images, okay, instead of giving a clinical situation, they can give you an image also, okay, and then they can ask you the management. So the first image that you can see, what are those? So it is a superficial injury to the epidermis only, okay, only the epidermal injury. These are known as abrasions. These are known as abrasions. It can also be seen in RTAs, but there would be extensive abrasions then. The next image that you can see down there is, these are lacerations, okay, these are lacerations. Important point, okay. Here you can see a wound which is cut, okay, but important thing over here you need to remember, 3 points you need to remember at least. First of all, margins कैसे दिख रहा है? Irregular or shaggy margins. How? Which type of margins? Which type of margins? Irregular margins are seen. Second point that you need to remember, that the nerves and the vessels would be cut या crushed. The nerve and vessels are crushed. The nerves and vessels are crushed. Nerves and vessels are crushed. If we talk about a similar differential diagnosis in the next picture over here, यहाँ पे क्या दिख रहा है? The margins are regular margins. Here the margins are regular margins. Important. And second, and yeah, fish stealing is an important feature usually. It is seen with a sharp instrument. Okay, fish stealing is seen. Fish stealing. And third important feature that you need to remember, the nerves and vessels would be cut. Nerves and vessels would be cut. So this is which type of wound? Anybody? Yeah, यहाँ पे suicidal wound दिख रहा है. Which type? Suicidal is the form, huh? Those are another names, guys. Incised wound. It is a incised wound. Please remember, this is a incised wound. So this is how you differentiate a laceration and an incised wound. Laceration में margins कैसे होते हैं? Laceration margins were, incised wound margins are, fish stealing is seen है, fish stealing is seen है, incised wound. Nerve and vessels are cut in, nerve and vessels are crushed in lacerations. I hope you can differentiate these now. Moving further, the important question that had come earlier. This is degloving injury. This is a degloving injury, or also known as, very good, avulsion injury. This is also known as a, so this is which type of injury? Avulsion or degloving or avulsion. An important question which has been asked, that here what happens, a flap is created, ठीक है? The tissues or the skin separates from the underlying surface. Okay, a flap is created in degloving or avulsion injury. Important question that has been asked, the plane of separation is between which layers? Anybody? Plane of separation is? Plane of separation, anybody? Between the subcutaneous fat and deep fascia. Between the subcutaneous fat and, so it is a deeper wound. Please remember, it is not a superficial wound. So degloving या avulsion में plane of separation is between subcutaneous fat लिखा है. Subcutaneous fat and between deep fascia and, so plane of separation is between subcutaneous fat and deep fascia. Which type of injury? Degloving, also known as avulsion injury. Important to be remembered. And the last image that you can see, here there is extravasation of blood, okay, due to rupture of venules or capillaries. This is known as a bruise, also known as a contusion. So the last image is a bruise or a contusion. If there is extensive rupture of vessels, that can lead to a hematoma. I hope this is fine. Then classification of wounds can also be either tidy wounds or untidy wounds. Tidy wounds means which are clean wounds, okay, having sharp margins, just like our surgical wounds. Okay, so those are clean wounds. Important. So clean wounds, they usually heal by primary intention. ये in healing पूछा गया है पहले, इसलिए बता रहा हूँ बस. Tidy wounds heal by primary intention. Whereas untidy wounds, these would be the wounds of your road traffic accidents. They would contain some debris, okay? मिट्टी हो सकती है, पत्थर हो सकते हैं. They would contain some dead tissue or necrotic tissue, right? So important, there would be debris or dead tissue in untidy wounds, okay? Debris or dead tissue. And therefore, what would be required? They will heal by secondary intention. What would be required for treatment? Very good. It is debridement. What is required for treatment? So debridement means removal of the dead or the necrotic tissue, that is known as debridement. So debridement is required for which type of wounds? Untidy wounds. Okay. And debridement के लिए एक question आया था. Golden period for debridement. Very good. Golden period of debridement is? Golden period of debridement is? Golden period of debridement is? So if debridement is performed within 6 hours of injury, there would be very good outcome. Moving further to the next one that we have in line, the first image that you can see, these are known as puncture bites or puncture wounds. These are puncture bites or puncture wounds due to nail injuries. An important feature to be remembered, these will require thorough cleaning and irrigation. Okay, these will require thorough cleaning and irrigation because they can land up the patient in infection that can progress to amputation even. ठीक है इसीलिए. Moving further to the next one. This is a usually seen in road traffic accidents or patients who are, or the individuals who are working in industries, heavy industries. Very good. It is a crush injury. This is a crush injury. Important. Okay. So crush injury mein all the structures are damaged. Even the bone can be damaged. Everything is damaged. Okay. So please remember. So this is the condition of a crush injury, and see this is the art. Okay, and the artist is a surgeon. That's why surgery is good. So please remember this is a crush injury, and there is a risk of increase of pressure in the osteofacial compartment, right? And this increase of pressure in osteofacial compartment is known as which syndrome? Anybody? Compartment syndrome. Important question from orthopedics. Compartment syndrome. And what is the treatment of choice for compartment syndrome? Fasciotomy. What is the treatment of choice for compartment syndrome? Fasciotomy. You just give a cut on the fascia to release the pressure. Okay? Then moving further to the next one. What is this? Very good. It is a bed sore or a pressure sore. It is a bed sore or a pressure sore. Usually seen in patients who are usually in supine position or immobilized for a longer duration of time, like after a vertebral fracture or usually after a major surgery, okay, or paraplegic, quadriplegic patients. Okay? They are constantly in contact. Some part of their body is constantly under pressure, and they can develop these ulcers known as bed sores or pressure sores. Important one-liner that has been asked. यहाँ पे वही part include किया गया है. Most common site of pressure sores is sacrum. Yes, very good. Most common site of pressure sores is most common site of pressure sources, most common site of pressure sources, sacrum, because it is constantly under pressure when a patient is lying supine. Okay, important. Moving further, guys, now talking about scars. So after a wound heals, कोई issue है अब तक? कोई दिक्कत नहीं है. ये important one liner से ये बस याद रखना है. Once you go home, just revise it once. Easy है बहुत ज़्यादा. ठीक है? No issues with this. So now a wound whenever it heals, it will heal with a scar. So scar is due to deposition of anybody? Granulation tissue is on the way. It is not present in the scar. Deposition of, very good, collagen and fibroblast. Scar is due to deposition of collagen and scar is due to deposition of so these collagen and fibroblast deposit and they lead to scar formation. But sometimes what happens, there would be excess deposition of these collagen and fibroblast. Excess deposition of collagen and fibroblast will lead to adverse or bad looking scars, right? So adverse scars or bad looking scars are nothing but due to excess deposition of collagen and fibroblast. So there are two important types of bad scars or adverse scars. Those are, the first one that you can see is a, very good, it is a hypertrophic scar. The first one is a, whereas the second image is a keloid scar. Second one is a keloid one. Okay. So hypertrophic scar is usually seen in which age group? Children. Hypertrophic scar is seen in children. Okay, important. And hypertrophic scar usually seen after any mild injury that you have. Okay, you usually get these types of scars in day-to-day life. But keloid is important. Please remember, keloid is usually more common in which sex? It is more common in keloid is more common in females. Okay, it is more common in which race? Blacks, Africans. Okay, it is more common in which race? Black race. Okay, important one. And it can be familial also. It can be in a family also to develop keloids. So keloid is nothing but deposition of collagen and fibroblast in such huge amount that it will grow out of the wound margins. Okay, in a claw-like manner. Okay, so keloid grows in a claw-like manner. Important thing that you need to remember. Okay. So most common site बता दो, keloid or hypertrophic scar. Very good. Most common site for hypertrophic and keloid is? Most common site for hypertrophic and keloid is? Most common site of scar is? Most common site of bad scar is? Sternum. Important. Okay. Then treatment of keloid. This was a question which has been asked. So if they just ask about the treatment, so the most commonly performed one usually is a intrakeloidal or intralesional injection of triamcinolone. That is a steroid. Okay, don't worry. अगर steroid याद है तो triamcinolone एक बार ये देख लेना, because triamcinolone can come in options. Okay, so please remember, treatment of steroid would be intrakeloidal injection of triamcinolone. Which injection? Triamcinolone is given usually in the keloid or in the lesion. Okay, so the keloid regresses after this. But if they ask you about the treatment of choice, anybody? Very good. Treatment of choice would be surgical excision. Treatment of choice is surgical excision. It is followed by a cobalt radiotherapy. Okay, important, to prevent recurrence. Then moving further to trauma, a topic that we have already studied in PSM. Just revising once, trauma can be ranging from a road traffic accident to a disaster. Disaster is the responsibility of anybody? NDMA. I knew this. Please remember, disaster is the responsibility of NDMA, National Disaster Management Authority. And the chairperson of NDMA is the Prime Minister. But the ministry responsible is the Home Ministry. And the center at which rehabilitation work occurs is the Shabash. Then talking about triage now. So triage usually is done either by a doctor or a paramedical assistant at the disaster site itself. Okay? And triage is what? Segregation or separation or categorization of patients. What is triage? Segregation of patients. What is triage? What is a triage? Segregation of patients on the severity of injury, likelihood of survival. Triage is usually done on the likelihood of survival. If you actually do the triage according to this, then you can help out the patient. Severity of injury, definitely the black category would need, they would be more severely injured. Okay, but please remember, segregation of patients done on the likelihood of survival. It is done on the likelihood of survival. किसके बचने के chances ज़्यादा है? Important. So according to that, we divide these patients in 4 categories: highest, high, low, and least priority. Highest priority would be high priority, yellow or blue. Blue भी आ सकता है कभी option में. So please remember, high priority is yellow or blue. Low priority would be low priority are, and least priority would be black patients. So जल्दी से बता दो, dead or moribund patients would come under dead, moribund patients under. So here we will have dead, moribund और जिनको बचा नहीं सकते, मतलब एक सेकेंड बस। क्या दिक्कत है इसको? काय काय सिव्हिरिटी ऑफ इंजरी ना युजली ना सर्जरी वाले कॅटेगराइज करतात. अदरवाइज इट इज लाइकलीहुड ऑफ सर्वायवर ओनली. पीएसएम किंवा कोणतं पण जनरल मेडिसिनचं पाहिलं ना, लाइकलीहुड ऑफ सर्वायवर फॉर शुअर. वन लाईन तेच. तो क्या करना है? Just somebody, it is still loading. Just somebody send a message in the group telegram पे that we have restarted. Okay, wait. चलो 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 without any delay guys, let's start. Sorry, apologies for the issue that came along the way. चलो, are you serious? कोई ना, मैं बाद में लिख के भेज दूंगा, डोंट वरी. ठीक है. Let's start again. So triage was what? Segregation of patient depending on likelihood of survival. Important. Highest priority is high priority is yellow or blue. Low priority is green, and least priority would be unsalvageable patients in black. Unsalvageable in black. Moribund in moribund patients, dead patients, ambulatory patients जो चल फिर सकते हैं. minor injuries, life saving surgery within 24 hours, yellow or blue. If life saving surgery is required within 24 hours, then yellow or blue. If life saving surgery is required within 6 hours, then within 6 hours surgery, within 24 hours surgery, immediate resuscitation, red. अगर resuscitation लगता है ADC, then it is red category. I hope this is fine. Moving further, talking about skull injuries now, guys. So if we talk about skull injuries, the first X-ray that you can see over here, the lateral view of the skull X-ray. Okay, the arrow has been shown. I am not sure if you are actually able to visualize anything. So please remember the fracture line runs like this. So this type of fracture is known as a linear fracture. This is a linear fracture. Okay, single fracture line. Second, in this CT image, what can be seen? Due to a trauma, okay, due to some blunt trauma or a penetrating trauma can be there. This is which type of fracture? Anybody? Depressed fracture. Which type of fracture? This is which type of fracture? Depressed fracture, or also known as a dented fracture. There is a dent which is created. It is also known as a dented fracture. Dented fracture is also known as depressed fracture is also known as dented fracture. Important. Then if we talk about fractures of the cranial fossa, anterior cranial fossa fracture, which is the most common part? The most common part to get fractured is? Very good. It is the cribriform. Really sorry for this. सच्ची दिन अच्छा नहीं है, पता है. तबीयत भी खराब है. क्या हो जा रहा है इसको बार बार? इतने कैसे झटके आ रहे हैं इसको एकदम, ठीक है। Anterior cranial fossa fracture, most common part fractured is, most common part fractured is, most common part fractured in anterior cranial fossa is cribriform plate. Tell me the most common clinical feature, anybody? So if cribriform plate is fractured, there would be leakage of CSF from the nose, that is known as CSF. So very good. So most common clinical feature of ACF fracture, most common clinical feature of ACF fracture, most common part of ACF fracture, cribriform plate. Very good. And then in ACF fracture or anterior cranial fossa fracture, we can see this sign which is known as panda's eye or panda's eye or panda's eye or raccoon's eye. These are nothing but usually bilateral periorbital hematomas or ecchymosis. Okay, important. So it is known as which sign? Panda's sign or which sign? So panda's eyes or raccoon's eyes are a feature of anterior cranial fossa fracture. Important ये है. Next, moving further, talking about the middle cranial fossa fracture. The most common part to get fractured is petrous part of the temporal bone. Most common part to be fractured in MCF is, most common part to fractured in MCF is petrous part of the temporal bone. It is the weakest part. And what would be the most common clinical feature? CSF leakage from the ears. Now that is known as CSF autoria. So CSF autoria is a feature of CSF autoria is a feature of most common clinical feature of middle cranial fossa fracture is most common clinical feature of middle cranial fossa fracture is very good. And in CSF autoria, we can see this bluish or reddish discoloration over the mastoid surface. This is known as which sign? Battle sign. Which sign? So battle sign is a feature of MCF bolo. Battle sign is a feature of battle sign is a fracture of battle sign is a feature of कुछ MCF ही बोल रहे. अरे MCF fracture. So CSF autoria is a feature of CSF rhinorrhea is a feature of panda or raccoon's eye is a feature of and battle sign is a feature of. No issues. I hope everybody is clear with this. Moving further, then talking about this, that is a blowout fracture. Blowout fracture is a fracture of orbit. Okay, blowout fracture is a fracture of the orbit, and the most common wall fractured in orbit is inferior wall of the floor. Most common wall fractured in orbit. Most common wall fractured in orbit. Most common wall fractured in orbit. Floor. Important. Blowout fractures are fractures of orbit. Then if we talk about facial trauma, so upper facial trauma की अगर हम बात करें, there can be these La-Fortes fractures. Okay, La-Fortes fractures are usually three types: type 1, type 2, and type 3. Images can be asked. So, if the fracture line passes from the palate, it is known as a type 1 fracture. It is known as a type 1 or a horizontal fracture. Then in type 2 La-Forte, the fracture line passes from the bridge of the nose and it gives the pyramidal shape. So pyramidal fracture is a type, pyramidal is type, pyramidal is type, horizontal is type, horizontal is type. And if the fracture line traverses through the orbits and there is separation of upper and lower part of the facial skeleton, this is known as La-Forte type 3. Okay, important. Disjunction होता है usually इस पे, ठीक है, disjunction of the facial skeleton. So horizontal fracture, pyramidal fracture, and disjunction of facial skeleton. No issues till here. If images आते हैं correct करके आना. Then moving further, talking about the lower facial fractures. ठीक है, and the most commonly injured bone would be your mandible. Most common site of mandibular fracture, anybody? Very good. It is condyle. Okay. Most common site of condyle. Most common site of mandibular fracture is. Most common site of mandibular fracture is. Question from anatomy also important. Okay. Ortho also. Most common site of mandibular fracture. Most common site of mandibular fracture. Followed by angle. Followed by most common site of mandibular fracture is. Second most common is. Then there can be a dangerous fracture seen in mandible if the fracture line is present over there. Okay, and this type of fracture is known as a butterfly fracture. This type of a fracture is known as a. And why is it dangerous? Anybody? Very good. The safety muscle of tongue is released, which is known as genioglossus. Safety muscle of tongue. Safety muscle of tongue. So the safety muscle of tongue, genioglossus, is attached over here. If this part undergoes fracture, the safety muscle of tongue is released and the tongue will fall back, leading to asphyxia. Okay, release of genioglossus muscle due to fracture of mandible. Due to fracture of which type of fracture? Butterfly fracture is dangerous due to sharp bash. Moving further, talking about chest trauma now. Now please tell me the most common part fractured in chest trauma would be. Most common part fractured in chest trauma are ribs. से बना होता है. कौन सी ribs? Anybody? 4 to 9 ribs. Most common fractured ribs are. Most commonly fractured ribs are. Most commonly fractured ribs are. Anteriorly वही दिखती है ना, बस 4 to 9 ही prone injury के लिए. Moving further, now please tell me most common cause of death in cases of blunt chest trauma. Blunt trauma usually would not lead to aortic rupture. अरे एक तो बताओ. Tracheobronchial rupture. Most common cause of death in blunt chest trauma is. Most common cause of death in blunt chest trauma is. Most common cause of death in blunt chest trauma is tracheobronchial rupture. Yes, left side की रिब ज़्यादा prone होती है damage के लिए. Sorry. Moving further, guys. Now, if I talk about tension pneumothorax, right? So tension pneumothorax is usually traumatic, whereas spontaneous pneumothorax की most common cause is emphysema. Rupture of the bloods of emphysema can lead to spontaneous pneumothorax, whereas tension pneumothorax most commonly is caused by. Most common cause of tension pneumothorax. Most common cause of tension pneumothorax. Most common cause of spontaneous pneumothorax. Emphysema. Okay, in tension pneumothorax, usually you need to remember 3 important features on the chest X-ray. ठीक है? So the 3 important features can be remembered as A, B, C. A for anybody? क्या क्या? Airway, breathing, circulation. BLS नहीं है ये. Absent breath sounds. A for B for breathlessness. B for and C for congested or distended neck veins. Important. So ABC of tension pneumothorax. A for B for and C for congested neck veins. These 3 are important features. If you see this in the question, it is absolutely tension pneumothorax. Okay. And if we talk about the chest X-ray over here, on the affected side you can see what? 3 important features are seen. First of all, if you can see this lung, it has collapsed because there is accumulation of air in the pleural cavity. Pneumothorax क्या होता है? Accumulation of air in the pleural cavity. Okay, that causes the lung to collapse, right? So first of all, there would be hyperlucency of lung. क्या होगा? Hyperlucency दिखेगी. Increased blackening दिख रही है ना? बड़ी सी लंग दिख रही है. Highly inflated lung. ठीक है? वो actually लंग नहीं है. So hyperlucency is seen. Second feature that you can see is the trachea is shifted to so opposite या contralateral shift of trachea. What is seen? Contralateral tracheal shift. What is seen? So chest X-ray features of tension pneumothorax. First is First is hyperlucency. First is second is contralateral tracheal shift. That means the trachea and the mediastinum are shifted towards the opposite side because air भर गई है ना ज़्यादा इसीलिए. Then treatment would be anybody important. My question is first line management. बताओ. First line management is anybody? So either we'll insert a needle or ICT क्या डालोगे पहले? First line अगर पूछता हूँ तो needle insertion important. A wide bore needle is inserted where? Needle insertion in the second intercostal space. In which line? Mid-clavicular line. Important. And then a definitive management would be intercostal tube drainage. Intercostal tube drainage का insertion करना होता है. That is the definitive management. And ICT is inserted in which line? So जो लोग नहीं समझे जिनको डाउट है, please remember when a patient of pneumothorax presents to you in emergency, the first management that you will do is insert a needle in the second intercostal space. On which line? On which line? Which intercostal space? What is done? Needle insertion. This is the first line management. But if they ask you about definitive management, क्या करोगे? ICT insertion. What is done? Intercostal drainage tube is inserted. In which space? Which line? Mid-axillary line. And if in the drainage, for example, there is more than 1500 ml of blood loss, okay, or if the patient's condition is deteriorating, then you will further move to thoracotomia, thoracoscopy, okay, any of the surgeries. But first line would be needle insertion. First line is definitive. No issues till here. कोई issue हो तो पूछ लो अभी. Moving further, talking about flail chest now. What is flail chest? Fracture of two हो गया. चलो. Fracture of two consecutive ribs on the same side. On the या फिर fracture of at least one rib on each side. Okay, दोनों can be considered as flail chest. Fracture of two ribs on, fracture of two consecutive ribs on, fracture of two consecutive ribs on, or fracture of one rib on each side. That is known as flail chest. And which type of respiration is seen in flail chest? Paradoxical. Which type of respiration? Paradoxical respiration is a feature of flail chest. Okay, the respiration would be in asynchrony. Okay, that is known as paradoxical respiration. I hope this is clear. And flail chest wala patient is usually managed with analgesics, pain relief, and oxygen therapy with IPPV, intermittent positive pressure ventilation. No issues till here. कोई दिक्कत है तो बता दो पहले. Moving further, talking about abdominal trauma के one-liners now. I hope everybody has सबने रख लिए होंगे अब तक. Most common organ injured in blunt abdominal trauma. Most common organ injured in blunt abdominal trauma. Most common organ injured in blunt abdominal trauma. Followed by. Very good. Then most common organ injured in penetrating abdominal trauma. Most common organ injured in penetrating abdominal trauma. Intestine वाले हाथ ऊपर करो. Liver वाले हाथ ऊपर करो. So it is liver. Please remember, it is liver. Okay, parenchymatous organ is mainly damaged and followed by intestine. ठीक है? So most common organ injured in penetrating trauma. Most common organ injured in penetrating abdominal trauma. Followed by small intestine या small intestine जो भी. Most common organ injured in seed bed trauma. This was the question. It is your seed bed trauma में, blunt trauma में, penetrating trauma में. So usually in cases of seed bed trauma or seed bed injury due to hyperflexion, mesentery is ruptured at the duodenojejunal flexure. Okay, अगर पूछा जाता है तो, otherwise mesentery is only the one line. Most common organ injured in cases of blast injury. Most common organ injured in blast injury is tympanic membrane or eardrum. Most common organ injured in blast injuries is tympanic membrane नहीं ऑप्शन में. उसके पहले कुछ नहीं आता, हवा भरो. So usually air-filled cavities rupture in blast injuries. Okay, if eardrum is not an option, then if trachea is not an option, then if lungs are not an option, then stomach or intestine, anything you can say. Okay, stomach or intestine, GIT मतलब, ठीक है. So please remember, most common organ injured in blast injuries. Most common organ injured in blast injuries, followed by शाबाश. No issues. अगर कोई दिक्कत आ रही है पीछे वाले थोड़े में को, क्या हो रहा है, कोई दिक्कत है? All of you are fine ना, ठीक हो? तो जोश लाओ वापस. या तबीयत खराब है तो भी मैं चिल्ला रहा हूँ, चिल्लाओ अच्छे से. Then talking about splenic injury now. Okay, if there is damage to your spleen, if it is a hemodynamically stable patient, क्या करोगे? Conservative management. One liner है तो याद रख लेना. If splenic damage is there and patient is stable, splenic damage में patient stable, splenic injury patient stable, splenic injury patient stable, but splenic injury patient unstable. So the patient is hemodynamically unstable. He is in shock. That means there is constant bleeding going on. So unstable patient में splenorrhaphy, that is sutures to the spleen. और if splenorrhaphy से भी राहत नहीं आती है, if constant bleeding is going on, then splenectomy. Then either partial or total splenectomy can be done. So splenic injury patient stable है तो, splenic injury patient stable है तो, splenic injury patient unstable है तो, splenic injury patient unstable है तो, splenorrhaphy नहीं control तो splenectomy. Anybody important one liner? Which is the seen in cases of splenic injury? When the pain radiates to the left shoulder. Kehr's sign. Okay, important. It is known as sign in splenic injury is that means the pain is radiating to the left shoulder. That is Kehr's sign. Moving further, talking about shock index now. So shock index का formula anybody? Heart rate upon systolic blood pressure. Shock index is systolic blood pressure. Heart rate कितना होता है? Normal heart rate 72. Systolic blood pressure normally. So therefore, in normal conditions, shock index would be less than 1. Shock index in normal conditions would be less than 1. Okay. So if shock index is less than 1 and a patient of trauma has presented to you, first line investigation क्या होगा? CST? Fast. Okay. So first line investigation would be fast, and this was an important one-liner that has been asked. Fast is focused assessment by sonography a trauma. Fast. So first line patient, if patient is stable there. First line investigation if patient is stable there. If first line investigation if patient is hemodynamically stable there. Fast. Okay. Focus assessment or by sonography in trauma. Then after fast, investigation of choice would be investigation of choice for abdominal trauma. CECT abdomen. Investigation of choices. So ये confuse मत होना, question में clinical आएगा and don't get confused. If a patient of abdominal trauma has presented to you and his shock index is less than 1, question is first line investigation. It would be first line investigation is but investigation of choices CCT abdomen. But as CCT takes more time and if the patient is actively bleeding, we cannot send the patient for CCT directly. So we assess him first of all by ultrasound. कोई issues यहाँ पे जो तुम E fast बोल रहे हो ना, that is extended fast. Usually in fast 4 passes are there: perihepatic, perisplenic, pericardiac and pelvic. Okay, along with that if you add 2 more passes, right and left, thoracic passes, then it becomes a extended or a E fast. Okay, that is actually a fast only, but you suspect thoracic injuries also, तो E fast बोलोगे. Only abdominal injuries then only कोई issue नहीं है. Investigation of choice CCT abdomen. अब तो गलतियां मत करो. Then if the patient is hemodynamically stable, मतलब उसमें tachycardia है, उसका heart rate 120 हो गया, blood pressure is falling, hypertension 50, so shock index would be more than 1. समझा shock index कैसे calculate कर रहे हैं? नहीं समझा? एक बस example देख लो. Now a patient of abdominal trauma is presenting to you with current active bleeding in the abdomen. His systolic blood pressure will definitely fall. Bleeding हो रही है तो BP fall करेगा ना? It would be 50 समझ लो. And heart rate is a reflex tachycardia कभी भी. Therefore the heart rate is 120. So now the shock index would be more than 1. Shock index would be, so if shock index is more than 1, it is a hemodynamically unstable patient. Shock index more than 1, unstable बोल लो. Shock index more than 1, shock index more than 1, shock index less than 1, कोई issue इसमें अभी. So if shock index is more than 1, then क्या करोगे? सबसे फर्स्ट लाइन पूछ रहा हूं मैं, सब में फास्ट क्यों करना है? शॉक इंडेक्स से ब्लीड कर रहा है तुम्हारा पेशेंट, अल्ट्रासाउंड का भी टाइम है. सबसे पहले यू विल डू बेसिक रिससिटेशन. फर्स्ट लाइन वुड बी, फर्स्ट लाइन इज बेसिक रिससिटेशन फॉलोड बाय एक्सप्लोरेटरी लेप्रोटोमी. नाउ you have no time, the patient is currently bleeding in abdomen, मर जाएगा, BP fall करेगा और तो उसका तो ठीक है. So definitive management would be exploratory laparotomy. Exploratory मतलब खोलोगे उसके abdomen और देखोगे कहां से bleed कर रहा है, ठीक है, घूम के आओगे जरा, ठीक है. That is exploratory laparotomy. So hemodynamically unstable patient, first line is definitive is exploratory laparotomy. Now a question, one liner. If a patient of penetrating trauma is bleeding, ठीक है, मतलब most common site of penetrating trauma कौन सा है? Liver. Okay. Now tell me what is the manure that will perform? Pringles manure. The manure is known as when you compress the hepatoduodenal ligament. When you compress the hepatoduodenal ligament, which contains the arteries, therefore the patient will stop bleeding. ठीक है? Which is known as which manure? Pringles manure. Which manure? Pringles manure. I hope this is fine with everybody. Moving further, a very important question from forensic medicine surgery. ये बिल्कुल नहीं भूलना है, हर बार एक क्वेश्चन इसमें से आता ही है. हेमोरेजेस. Shock index is less than 1, no issues then you can send him for fast in blunt trauma also. Then intracranial hemorrhages. Guys, जल्दी से पहले तो आइडेंटिफाई करना है, फिर 2-3 इंपॉर्टेंट पॉइंट डिस्कस करने हैं जिससे क्वेश्चन सॉल्व करने में आसानी हो. अब दिस इज फाइन. सो द first one is extradural hemorrhage, EDH, extradural hemorrhage. Now please tell me which type of opacity is seen? Biconvex or lens shaped? Biconvex or lens shaped opacity is seen. Second feature, most common vessel injured is middle meningeal artery rupture. Then third feature, treatment of choices. एक सेकेंड, एक बताओ, मैंने मैनिटॉल का एक कॉन्ट्राइंडिकेशन बोला था, किसी को याद हो तो? मैनिटॉल इज कॉन्ट्राइंडिकेटेड इन एक्टिव सेरेब्रल हेमोरेजेस. प्लीज रिमेंबर, इफ अ पेशेंट इज suffering from active hemorrhage, mannitol should be contraindicated. There will not as such effect in extradural hemorrhage, but intracerebral में तो it is absolutely contraindicated. But we try to avoid it there also because you are not sure yet. ठीक है, that is the reason, because there can be multiple other hemorrhages also. So when in chronic cases, if the ICT raises, then and then only we use mannitol. ठीक है, I hope this is fine. So which is the most common vessel injured in EDH? Most common vessel injured in EDH? Which type of opacity? Biconvex or lens shaped opacity. Treatment of choices? Burr hole surgery. Yes, decompressive craniectomy. First of all, we'll go with burr hole surgery. Decompressive craniectomy is usually done in cases after a burr hole surgery is failed. ठीक है ना, किसी का अगर तुम किसी का सेरेब्रम हटा रहे हो, क्रेनियम ये कर रहे हो, तो दिक्कत आएगी फिर. So treatment of choice for EDH is? Treatment of choice for EDH is? Landmark for EDH, landmark for burr hole surgery is? A question from anatomy which was asked. Landmark for burr hole surgery is? Pterion. Landmark for burr hole surgery? Landmark for burr hole surgery? And burr hole surgery is performed in? Extradural hemorrhages. Important. And there is an important characteristic feature. The patient will be unconscious, regain his consciousness, again will be unconscious. This is known as lucid interval. Very good. These 4 points EDH is solved. Moving to the next one. ये जो next image है, it is what? Subdural hemorrhage, SDH. Important. So subdural hemorrhage में which type of opacity? Crescent shaped opacity you can say, or a concave or convex opacity. So which type of opacity? Concave or convex or crescent shaped or? Crescent shaped opacity is a feature of subdural hemorrhage. Most common vessel injured in SDH is? Yes, bridging, cortical bridging emissary veins. इतना बड़ा नाम है, bridging veins याद रखो. So most common vessel injured in SDH is? Most common vessels injured in SDH is? Most common vessel injured in SDH is? Bridging veins. Okay, important. यहाँ पे अगर chronic condition है, then you can prefer mannitol to decrease ICT. ठीक है, no issues with this अभी. Moving further to the next one. Here the blood is seen in the ventricles. Ventricles में CSF होता है, so here there is a CSF mixed blood. So this is a subarachnoid hemorrhage. Okay, subarachnoid hemorrhage. Which, so here opacity would be in the, opacity is present in the, wow, center. Sylvian fissure. Opacity is present in, opacity is present in Sylvian. ये जो साइड में दिख रही है ना, that is your Sylvian fissure. ठीक है, and it is also present in the ventricles. So SH में opacity is present at 2 places. Second ventricles. कोई इशू इसमें? अगर सफेदी तुम्हें कहाँ दिखती है, ventricles में या fissure में, तो कौन सा टाइप का hemorrhage होगा? Subarachnoid hemorrhage. Now tell me the most common vessel injured in subarachnoid hemorrhage. Most common vessel, ठीक है, vessel is your berry aneurysms of which artery? Anterior communicating artery. Berry aneurysms are commonly seen in? Berry aneurysms are commonly seen in? So these very छोटा aneurysms, they will rupture and lead to which type of hemorrhage? But a question is, most common cause of SAH. Then your answer would be? Most common cause of SAH is? Trauma. Most common cause of SAH is? Most common cause of SAH is? Trauma. Okay. If they ask you about the vessels, then which vessel? Anterior communicating artery. Due to berry aneurysm rupture. No issues here? ठीक है. Last type of hemorrhage that we can see. Opacity is seen in the cerebrum. हाँ. Here at the place of putamen or basal ganglia. This is? कौन सा टाइप का hemorrhage है? Intracerebral hemorrhage. This is a so there is bleeding or hemorrhage in the cerebrum. Okay, that's why it is known as the intracerebral hemorrhage. Don't confuse it with intracranial. Cranial मतलब कोई भी hemorrhage would be intracranial. And अगर brain parenchyma में होता है, that is known as the intracerebral hemorrhage. Now tell me the most common vessel injured. MCA इतनी बड़ी अगर होगी तो पेशेंट विल सफर फ्रॉम स्ट्रोक. Charcot's artery or the lenticulostriate artery. Most common vessel affected in ICH. Most common vessel affected in ICH. Charcot's artery, also known as lenticulostriate artery. Important. Which supplies basal ganglia. Most common site. A very important and a repeated question. Most common site of ICH is. Most common site of ICH is. Putamen. Most common site of intracranial hemorrhage is. Putamen. Most common vessel injured is. कोई दिक्कत है पीछे? वेरी इंपॉर्टेंट टॉपिक. अगर नहीं समझ में आ रहा अभी बताओ, बिकॉज फॉर श्योर एक क्वेश्चन तो इसमें से होगा. इफ यू आर नॉट अटेंटिव, ये एक क्वेश्चन मिस कर दोगे, बिकॉज आई एम नॉट गोइंग टू कवर दिस इन मेडिसिन अगेन. ठीक है, अब ये टाइम नहीं है बार बार मैं कवर करूं. सो जल्दी से मैं फीचर पूछता हूं, क्विज खेलते हैं. Lucid interval is the feature of EDH, extradural hemorrhage. Crescent shape opacity is seen in Charcot's artery is most common site of intracerebral is most common site of intracerebral hemorrhage. Bridging vein rupture leads to most common vessel injured in EDH. Middle meningeal artery. Treatment of choice for EDH. One hole surgery. हाँ बोलो. ICH. So ICH मतलब कोई भी हिमरेज जो ब्रेन पैरेंकाइमा में हो रहा है. ठीक है, सेरेब्रम में कोई भी हिमरेज हो उसको ICH बोलेंगे, इंट्रा सेरेब्रल हिमरेज. ठीक है, एक इंपॉर्टेंट पॉइंट. यहाँ पे ओपेसिटी कहाँ दिख रही है तुम्हें? वेंट्रिकल स्प्लीन दिख रहा है, कोई दिक्कत नहीं है. कहाँ पे है? ब्रेन पैरेंकाइमा में, सेरेब्रम में दिख रही है ओपेसिटी. ओपेसिटी का मतलब होता है हिमरेज. ओपेसिटी अगर दिखती है दैट मींस opacity मतलब hemorrhage. and lucency मतलब ischemia या infarct. lucency मतलब so whitish मतलब hemorrhage, blackish मतलब infarct. black मतलब white मतलब hemorrhage. ठीक है, समझ में आ गया. so ये important है. the most common vessel injured अगर मैं कहूँ, that is which artery? Charcot's artery. कौन सी artery? Charcot's artery is also known as lenticulostriate artery. Lenticle का मतलब होता है basal ganglia. So the artery which supplies basal ganglia is the most common artery damaged in cases of intracerebral hemorrhage. And the most common site of hemorrhage would be ये जो दिख रही है, यही putamen. No issues? I hope it is clear. यही याद रखना है बस तुम्हें. Moving further, guys, now talking about neck trauma. So just before moving further, I want to tell a question from August examination of abdominal trauma. ये August exam का question था. And abdomen is usually divided into 3 zones. Zone 1 is the middle zone. ठीक है, this zone. Zone 2 is the lateral zone, and zone 3 is the pelvic zone. I hope it is fine. Central is zone, lateral are zone, and pelvic is zone. Now they had asked, injury to which of the zones will require exploratory laparotomy? Immediate exploratory laparotomy. Zone 1 and there were options like this. Zone 1 and 3, 1 and 2, 2 and 3, etc. 1 and 3. 1 and 3. Important point क्यों बता रहा हूँ? Please remember, abdominal injury to zone 1 can lead to damage of the aorta and the inferior vena cava, the major blood vessels, leading to extensive hemorrhage. First thing. Second, damage to the pelvic region or trauma to the pelvic region can also cause damage of the iliac arteries, again branches of the aorta. Along with that, there can be damage to important structures like your pelvis vagara, and pelvic fractures usually lead to extensive blood loss. Okay, maximum blood loss is due to pelvic fractures. ठीक है, no issues. So which zones of abdomen will require immediate exploratory laparotomy? Which zones of abdomen will require immediate exploratory laparotomy? Lapara means abdomen, otomy means opening. तो तुम ओपन करके देख रहे हो, कहाँ कोई दिक्कत है क्या? ठीक है, कोई इशू नहीं है यहाँ पे. Important one liner you need to remember. Moving further, talking about neck trauma now. Neck is also divided into 3 zones. Zone 1 is from sternal notch to cricoid. Zone 2 from cricoid to angle, and zone 3 above. ये इंपॉर्टेंट नहीं याद रखना, इंपॉर्टेंट ये याद रखना है. अब बताओ, blunt trauma of neck most commonly will lead to Blunt trauma to neck commonly leads to cervical vertebral fracture. Blunt trauma neck leads to blunt trauma neck leads to blunt trauma neck leads to cervical vertebral fracture. And treatment क्या दोगे इसमें? A conservative management. Please remember, in cases of vertebral fractures, conservative management is given. A cervical collar, also known as a Philadelphia collar. Which collar? Which collar? Due to fracture of cervical vertebrae. Conservative management. Then, if in cases of penetrating trauma to the neck, please tell me there is highest risk in zone 1, zone 2 or zone 3? वन वाले, 2 वाले, 3 वाले और बाकी चौथा लाएगा कोई? So please remember, highest risk for penetrating trauma in neck is in zone 1. It is in zone 1 because esophagus, trachea as well as your major blood vessels like carotid are at a risk. So highest risk in penetrating neck trauma is in zone 1. इतना ही याद रखना है, वन लाइनर से याद रख लो बस. Moving further, talking about the Glasgow Coma Scale, GCS. A important thing that you need to remember. एक question GCS से बनता है. Sorry. If you could not remember it, okay, अगर पूरा याद नहीं रहता, try करो याद रखने की. अगर नहीं याद रहता, कम से कम ये लैंडमार्क्स याद रख लेना. ठीक है? So जल्दी से Glasgow Coma Scale is remembered as EVM. EVM होता है ना मशीन. E4V5M6. इंपॉर्टेंट ये है. अगर यही नहीं पता तो आगे जाके पक्का कर दिया करोगे. ठीक है? So EVM is mnemonic 4, 5, 6. ठीक है? So eye opening, spontaneous eye opening is eye opening to sound is आवाज दे रहे हो तो eye opening to pressure of pain is and no eye opening 1. Then talking about verbal response, if the patient is oriented to time, place and person it is 5. Patient is confused जैसे तुम अभी लग रहे हो 4. Inappropriate words, गाली दे patient तो 3. गाली दे patient तो incomprehensible sound बस आउ कर रहा है, उसके अलावा और कुछ नहीं बोल रहा. एंड कुछ बोल ही नहीं रहा तो 1. Then motor response, if the patient is obeying command, patient obeys command. If patient localizes pain, then normal flexion या withdraws on pain 4. abnormal flexion extension 2 and none. So minimum GCS score कितना होगा? Minimum GCS score is and maximum GCS score is so if the GCS score is between 13 to 15 तो normal होता है. 13 to 14 it is mild head injury. GCS score of 13 to it is moderate head injury between GCS score of moderate between mild between moderate between severe in और 3 मतलब सिधार गए. कोई इश्यू अगर हो ट्रॉमा में एटलीस्ट 1 लाइनर पढ़ लो. क्लिनिकल केस एक आधा आएगा, नहीं भी सॉल्व होता है, देयर इज नो मेजर इश्यू. ठीक है? मूविंग फर्दर टू बर्न्स नाउ. इंपॉर्टेंट क्वेश्चन, अगेन सिंगल क्वेश्चन comes from burns usually every examination. So please tell me, most common type of burns are scabs. Most common type of burns are गरम पानी, गरम चाय हर रोज तो गिराते हैं, so those are known as scars. Important. Most common hospital burns are ICU चल रहे पता है, but most common hospital burns are Flame burns. Most common hospital burns are most common hospital burns. Most common hospital burns. Most common burns overall. Scalds. Important. Okay. Then talking about an important feature. If I talk about cold burns, when there is exposure to extreme cold, like Siachen glacier, over there can be coagulation of proteins in the muscle, and that can lead to frostbite. Okay. Cold burns are. So this is a picture of frostbite. First of all, there would be color changes, just like Raynaud phenomena, and then there would be necrosis. Okay, I hope this is fine. Treatment for frostbite is treatment of rewarming. अरे गैंग्रीन पे पहुंचा भी नहीं है रे. Treatment of choice for frostbite is rewarming. Treatment of choice for frostbite is rewarming at 42 degrees Celsius usually. Moving further. Now if I talk about thermal burns, guys, heat की वजह से जो होता है, okay, those thermal burns can lead to damage of all the skin as well as the underlying structures. Now please tell me, in cases of burns, thermal burns की अगर बात करें, most common cause of infection would be one liner which has been asked twice. It is most common cause of burn infection is Pseudomonas. Most common source of infection is infection is the burn wound itself. Most common source of infection. Most common organism in cases of burn infections. No issues. I hope this is fine. Moving further, if I talk about inhalational burns, guys, so if a person inhalational burn है कैसे suspect करोगे? Very good. So inhalational burns है ये हम suspect करते हैं if there is any burn to the neck, to the face or to the scalp. First thing. Second feature, there would be signing of the nasal hairs. नाक के बाल जल जाएंगे. Signing of nasal hairs. Okay. And third, अगर तुम autopsy करते हो, then you will find soot deposition, soot particle deposition. I hope this is fine. So if there is inhalational burns, important step क्या होगा? Very good. Early intubation. Important step in inhalational burns is early intubation, because otherwise there would be laryngeal edema and the intubation can become difficult. Okay, so most important step in inhalational burns is early intubation. Then moving further, most common cause of immediate death would be in cases of burns. मुझे आज पता चला है sepsis immediately होगा. Immediate death. Very good. It is hypoxia. Most common cause of immediate death is hypoxia, asphyxia या suffocation. But only in cases of inhalational burns. अगर inhalational burn है और if the person was closed in single room, then if a person is roaming outside और उसको बाहर आग लग गई, तो most common cause of death would be immediate death would be neurogenic shock. Most common cause of death in burns is most common cause of immediate death in burns is most common cause of immediate death in burns is but most common cause of death in inhalational burns is most common cause of death in immediate death in inhalational burns is hypoxia. No issues in here. I hope it is fine. Moving further, most common cause of early death would be अब बोलो पता नहीं कब से लगा के रखा है hypovolemic shock. Most common cause of early death in burns. Most common cause of early death in burns. Most common cause of late death in burns. बस यही रट के बैठे थे कब से पता नहीं. Most common cause of late death in burns. Most common cause of late death in burns. Immediate death. Immediate death. Immediate death. Immediate death. मैंने बोला inhalational. Immediate death. Immediate death. Immediate death. It is neurogenic shock. Immediate death due to inhalational burns. Immediate death due to inhalational burns. Early death. अभी कोई दिक्कत नहीं है, घर पे जाके 2-4 बार और रट लेना, याद हो जाएगा. Moving further, Now there are some rules for burns total body surface area assessment. कितना surface जला है, for assessment of that we have some rules. First is for patchy burns we use the palm rule. तुम्हारा या patient का? Patient का palm. Okay. And one palm constitutes palm rule is used in patchy burns. Next, in children we use the Lund and Browder chart. Children we use Lund and Browder chart. Important. हद है मतलब, चलो आगे. Then in adults, tell me. Alexander Wallace's rule of 9. So Wallace's rule of 9 याद रखो. In adults, children, patchy burns, children, adults, Wallace's rule of 9. ठीक है. So अभी Wallace's rule of 9 देखते कितना याद है. हेड एंड नेक बोला मैंने. एंटीरियर हेड एंटीरियर नेक नहीं बोला. हेड एंड नेक 9%. हेड एंड नेक. Anterior chest, posterior chest, anterior abdomen, posterior abdomen, your back, perineum, lower limb, anterior lower limb, posterior lower limb. ठीक है, कोई इशू नहीं है अभी, ऐसे ही याद रखना. इसीलिए Wallace's rule of 9 बोला जाता है. इतने 9 है. Only except perineum, which constitutes. शाबाश. Moving further. Now talking about hospital management of burns. उसके पहले burns का classification देख लो. Important चीजें पढ़नी है बस. तो burn class ये 2 एक साथ है अपना. अब हमें डिवाइड करने की जरूरत नहीं है. 2A 2B, इट इज ओनली 2 फॉर अस. ठीक है. 3 and 4. सो फर्स्ट डिग्री बर्न्स, सेकंड डिग्री बर्न्स, थर्ड डिग्री बर्न्स एंड फोर्थ डिग्री बर्न्स. फर्स्ट डिग्री बर्न्स में ओनली द एपिडर्मिस इज बर्न. सेकंड डिग्री बर्न्स में एपिडर्मिस एंड सुपरफिशियल डर्मिस. एपिडर्मिस एंड इन विच डिग्री? सेकंड डिग्री. देन कंप्लीट डर्मिस इन underlying structures in bone, muscle, subcutaneous fat in underlying structure, complete dermis, the epidermis plus partial dermis, only epidermis, कोई इशू नहीं है. I hope this is fine. Important one liners आ सकते हैं. Blisters are a feature of which degree burns? Blisters are a feature of second degree burns. Okay, important. These blisters are seen. Okay, second A में, second B में rupture हो जाता है usually. ठीक है. Then scar is a feature of third degree. Scar is a feature of. So scar is this blackish जो leathery appearance है ना skin का, that is known as scar, which can compress your chest also and can lead to hypoxia also. ठीक है. So treatment of choice for scar is escarotomy, giving multiple cuts on the scar to release the pressure. Treatment of choice for scar is scar is a feature of third degree burns. Bones वगैरह damage हुए, skin grafting would be required in third or fourth degree. Skin grafting is required in. So usually if a patient is burning, क्या करोगे? चले जाओगे. पानी कैसा, बर्फ वाला? सो नॉर्मल रूम टेम्परेचर वाला पानी प्रेफर करोगे. ओके, इंपॉर्टेंट. You will stop, you will drop the patient and you will cool the patient either with room temperature water or a blanket. ठीक है, important thing. That is pre-hospital management. When a patient comes to you in hospital, क्या करोगे? So ABC, that is resuscitation, airway, breathing, circulation. Hospital में first line would be airway, breathing, circulation. That is resuscitation. Then definitive management क्या करोगे? Definitive management would be IV fluids. Okay, IV fluids usually start करोगे. Which fluids are preferred? Which fluid is preferred in burns? Which fluid is preferred in burns? Ringer lactate. Okay, so these are IV fluids for extensive burns. Okay, definitive management. If I ask you डिग्री वाइज जल्दी से बता दो. फर्स्ट डिग्री बर्न्स में डेफिनेटिव मैनेजमेंट है एक्सपोजर. हर एक में कंजर्वेटिव चिपका देना है, मतलब है. फर्स्ट डिग्री में डोंट डू एनीथिंग टू द बर्न्स, लीव देम एक्सपोज. फर्स्ट डिग्री में सेकंड डिग्री में ड्रेसिंग इज यूजुअली डन विद व्हिच ऑइंटमेंट? Silver sulfadiazine. Sulfasalazine is a drug. ठीक है. Dressing is done with which ointment? Burn dressing is done with? And dressing is done for which degree? Second degree. Okay. There is silver sulfadiazine, silver mafenide, silver nitrate or a mafenide acetate. Out of all, mafenide acetate is the most painful ointment to be used, but it is the only ointment which will penetrate the scars. ठीक है, बस ये याद रख लो. पेनफुल सबसे कौन सा है? Mafenide acetate. Moving further, third degree and fourth degree में third and fourth degree. See, usually in third degree, if scar is present, then escarotomy, and definitive would be. Now talking about skin grafting. Skin grafting के लिए usually we can take a partial graft. Okay, partial graft is that is the epidermis and some part of the dermis. And second would be full thickness graft. That means epidermis and complete dermis. Right? So partial graft or a full thickness graft. So please tell me, most common site for a partial graft would be? Anteromedial or anterolateral? Anterior thigh बोल दो चलो. Most common site for skin graft, partial graft is? Most common site for partial graft is? Anteromedial or anterolateral thigh. Most common site for full thickness graft is? Supraclavicular या post auricular area. Supraclavicular or post auricular area. Most common site for partial graft. Most common site for partial graft. Most common site for partial graft. Most common site for full thickness graft. Most common site for full thickness graft. Important. Okay, इनके नाइस भी है, याद रखने हो तो you can remember. Partial graft is usually taken with the help of Humby's knife, whereas complete or full thickness graft is taken with the help of Wolfie's blade. ठीक है. Then skin graft usually settles by कितना टाइम लगता है सेटल होने में उसको? 5 days. Skin graft settles by? Skin graft completely settles by? Skin graft settles by? Therefore, in burns, in other cases, physiotherapy started on day 1 itself. But if a skin graft is performed, physiotherapy would be started after? Skin grafting में physiotherapy started after? Physiotherapy में skin grafting physiotherapy started in skin grafting after? 5 days. Then कौन से वैक्यूम का? किस वैक्यूम असिस्टेड के लिए? अच्छा, वैक्यूम असिस्टेड में यूजुअली -125 to -130 प्रेशर रखा जाता है. Moving further, talking about fluids. क्या हुआ? फ्लूइड्स कौन से प्रेफर करते हैं इन बर्न्स पेशेंट? फ्लूइड प्रेफर्ड इन बर्न्स पेशेंट है, अगर क्रिस्टलाइड्स या कोलॉइड्स पूछा गया तो crystalloids. Fluids preferred in burn patients are? Fluid preferred in burn patients are? And the most preferred crystalloid is? Most preferred crystalloid is? But in children we will add? Child अभी ORS पे है ही नहीं हालत में. Along with RL we will add? Along with RL we will add? Along with RL we will add? DNS, dextrose, normal saline. No issues with this. For nutrition we add dextrose in children. Moving further, Parkland's formula पे पहले क्वेश्चन पूछा गया है. What is the Parkland's formula? 4 into kg into weight into body surface area. Important. Body surface area affected with burns. ठीक है ना? So what is Parkland's formula? 4 into weight into body surface area. ठीक है? We will get X volume. Okay, we will get X volume for example. So half of this should be given within first 8 hours. Half of this should be given within. Half of this should be given within. And next half should be given within. Next half should be given over 16 hours. No issues. The volume which we get from Parkland's formula, half of that is given in, and the next half is given in. No issues. Moving further. Now indications. ये इंडिकेशंस पूछे जाते हैं यूजुअली. इन एडल्ट्स तुम कब फ्लूइड दोगे, इन चिल्ड्रन तुम कब फ्लूइड दोगे या एडमिशन कब करोगे? इफ बर्न्स इन एडल्ट्स आर मोर देन 15% and burns in adults are more than, if burns in adults are more than, if burns in children are more than, if burns in children are more than, so indication of admission or IV fluid adults में, adults में, adults में, children में, then please tell me best indicator of fluid requirement. How you, ठीक है बताने की जरूरत नहीं पड़ी. How you will assess actually how much fluid is required to the patient? It is done by urine output, and this was a one-liner which has been asked. So best indicator for fluid requirement, best indicator for fluid requirement. Then if we talk about sutures guys, ठीक है, बाकी 10 तरह के सूचर्स याद करने की जरूरत नहीं है, बिकॉज ये तीन ही सूचर्स है जो क्लिनिकल प्रैक्टिस में यूज करते हैं हम लोग. ठीक है, सो एटलीस्ट ये 3 याद रख लेना अभी के लिए. So the first suture that are violet in color is known as vicryl. It is known as vicryl is also known as polyglactone. Vicryl is also known as अब tell me, vicryl is a natural suture or a synthetic suture? Vicryl is a synthetic suture. Vicryl is absorbable, non-absorbable? Vicryl is absorbable. Important. Okay, so 3 features you need to remember about vicryl. Violet color suture is known as vicryl. V for vicryl, V for violet. Vicryl is also known as polyglactone. It is which type of suture? Synthetic suture. And absorbable, non-absorbable? बस इतना याद रख लो. Moving further to this next one, black colored suture, the most commonly used suture, that is silk braided. Monofilament नहीं है वो, braided उधर ही लिखा हुआ है उन्होंने. ठीक है, it is a polyfilament suture. So silk suture, the black colored one is a silk suture. And silk suture is natural या synthetic? Silk is absorbable, non-absorbable? Absorbable, non-absorbable? Non-absorbable. Okay, therefore it has to be removed. ठीक है, कब रिमूव करते हैं वो कॉमनली FMGE में तो नहीं पूछते. ठीक है, so important one, and it is used for skin suturing वगैरह. Silk. Okay, for mucosa we prefer either vicryl or this one. This one is the yellow colored suture is a catgut. Yellow colored is a synthetic natural suture derived from submucosa of catgut ना, catgut या shipgut? So it is derived from submucosa of shipgut. So दो उसका नाम cat है. It is derived from the submucosa of the. No issues. ये क्वेश्चन पूछा गया है. कैटगट इज डिराइव्ड फ्रॉम सब म्यूकोजा ऑफ शीपगट के कौन से लेयर से? सब म्यूकोजा से. किस टाइप का सूचर है कैटगट? नेचुरल सूचर एंड इट इज अ absorbable suture. And last important point, अगर पूछा जाता है, catgut is usually stored in isopropyl alcohol. Catgut is stored in then talking about Jenkins rule. ये usually FMG में नहीं आता, but बस रट्टा मारना तो मार सकते हो. Jenkins rule is actually what? Suture length is to wound length ratio. It should be how much? Jenkins rule is ratio of between the suture length and the wound length. Whereas suture and skin thickness should be suture is to skin thickness is suture length is to wound length is it is known as which rule? जल्दी से इंस्ट्रूमेंट्स कर लेते हैं. ठीक है, ये पहला वाला इंस्ट्रूमेंट क्या है? It is a unipolar or a monopolar cautery. The first one is a unipolar or a monopolar cautery. Here you can see only one end of the cautery, right? So here what happens? The current comes from the machine. It goes via the tissue to the patient's body and it is absorbed back via the dispersive pad, which is usually kept on the leg of the patient. ठीक है? So the current should complete its circuit. Otherwise तुम्हारा patient ठीक है. So dispersive pad लगाना मत भूलना. So this is the unipolar cautery. Okay, yellow is used for cutting, blue is used for coagulation. Yellow for blue for. Then the next one, यहाँ पे तुम्हें क्या दिख रहा है? Cautery has two ends. That means so this is a bipolar cautery and this one is actually a foot pedal. ठीक है, foot से control करते हो. This is a foot pedal. So in this what happens? The circuit is completed in the machine itself. Via one end it comes, it goes to the tissue and via other end it goes back. Okay. So dispersive pad is required for unipolar cautery. Next one, what is this? Towel clips used for fixation of your surgical drape. Surgical drape एक को एक जगह रखने में क्या यूज करोगे? Towel clips. What are these? Next one, what are these? Normal artery forceps. What are these? Artery forceps. Okay. Usually they have this locking system known as ratchet. ठीक है. So artery forceps are used to clamp the artery or to achieve hemostasis, to stop bleeding. Right? We use this artery forceps. Next one, what is this? Humbee's knife. And Humbee's knife is used for next one, what are these? Mayo scissors. Yes, what are these? So it is used for dissection or cutting of fascia वगैरह. ठीक है, scissors होते normal. The first one, these are towel clips. Surgical drapes होते हैं ना green color के. Surgical site को तुम isolate करने के लिए use करते हो. So those are fixed with these towel clips. फालतू का होता है, छोड़. Moving further, the first one is a retractor. It is all of these, most of these are retractors which are used to hold back a tissue. जब भी surgery कर रहे होंगे, कट दोगे, tissue hold करोगे, कट दोगे, सबसे पहले skin, फिर fascia, फिर muscle. Okay, so these are actually taken away from the surgical site, right? So that is done by a retractor. So the first image is of a Lagenbach's retractor. First is a Lagenbach's retractor. Okay. Next, this one is a Devers. D जैसा दिख रहा है ना? This one is a Devers retractor. This one is a Fowde type जो है, Morris retractor. This one is a, and the last one is a Doyen's retractor. This one is a. So एक बारी देख लेना, Lagenbach's commonly पूछा जा सकता है because that is the most commonly used one. Okay, so बस images देख लेना. I have added it in previous FMG snaps also if you have not gone through that. Next, this has been asked in exam. These are Alice forceps. What are these? Alif's forceps. They are used to clamp or just to hold back anything. Okay, hold a tissue वगैरह. So Alif's forceps. And these usually how to differentiate? They have a tooth end. They have a tooth end. Tooth होते दांत होते हैं उसके आगे. And then this one. This also had come once in exam. These are the Babcock's forceps. Okay, they have a loop at the start. Okay, and this loop is usually used to hold delicate structures like ureter, bowel, CBD. Okay, these delicate structures. So for delicate structures we use delicate structures, thick structures, Ali's. Thick structures, fascia, tendon, ligament, ureter, colon. Okay, so important. And the last one is what? Proctoscope. Okay, proctoscope is used for visualization of the rectum. Procto means rectum. So proctoscope is used for visualizing the. So you insert this in the rectum or the anus, and then you withdraw this one. Okay, you withdraw this one for analysis of any hemorrhoids वगैरह. ठीक है? Don't perform in fissure. In fissure, proctoscopy is absolutely. With this, I hope we can come to an end. Tomorrow we'll start with vascular surgery. General is not over yet. Thank you so much. जल्दी खत्म करा इसलिए बजा रहे थे. चलो. Let's meet tomorrow. I'll inform you the time. यूजुअली नहीं आते. अगर तुम्हें याद रखना ही है